Okay, good morning, Lindsay.
Good morning.
I'm gonna wash my hands real quick.
Okay, great.
All right, it's good to see you. So today we're going to do a head-to-toe assessment on Lindsay. So for our purposes, we will not be disrobing. We did previous tests prior to this, which included some vision testing, Snellen, and with glasses, she is 20/20. We also did height, weight, blood pressure, all the vital signs, that sort of thing. So we are just going to do truly the head to toe at this point. So I'm actually going to first raise the bed a little bit to my level. And before you get out, remind me and we'll put it back down.
Okay.
There's a great height difference between the two of us. Okay, initially, all my equipment, and initially we're going to do the external, which is her skin, starting from the top of her head and her hair to the bottom of her feet. And I want to look at the color of her skin. That gives me an idea about her oxygen status. Just make sure there are no macules, no lesions, nothing to be concerned about. Do you have any moles that you're concerned about?
No.
Okay. And we'll just make sure there are no swollen anything, lymph nodes, anything of that nature. So what I would normally do, thank you, is start from the very top of her head, and what I'm doing is checking the texture of her hair, checking her scalp to make sure there are no lesions, no cuts, no bruises, no abrasions. And her hair looks great. It is even, the texture is good, and I feel nothing on her scalp. And then I would continue on her face. I will just inspect her face, and I don't see anything that's concerning her. No JVD, and her trachea is midline. And I will go ahead and palpate, and yes, it is midline. Go ahead and swallow for me. Okay, very good. And we'll also be checking the cranial nerves. So we'll start from the back. So right now we're going to do, let's see, we just swallowed. Actually, let's do it from the front. So I just need you to raise your eyebrows for me. Very good. Close your eyes really tight. Very good. And that means cranial nerve 7 is intact. I'm just going to whisper something to you, and I want you to whisper. Tell me what I said.
Broncos.
Very good.
Suck.
Very good. So cranial nerve number 8 is intact. Let's see, we're going to do your oculomotor test. So what I want you to do is just follow my finger. We're going to do the 6 cardinal directions, okay? And this is to check your gaze. Not moving your head. Very good. Very good. Very good. All intact. Now, have you clenched your teeth? Okay. And while you're doing that, just close your eyes. Just tell me when you feel it. Okay. Very good. And that's number 5 cranial nerve. It is intact. And now we're going to go ahead and do some of the vision testing while we're at it. I'm going to have you just tell me what, close one eye, tell me when you see and what number. Okay?
3, 2, 2, 3.
Very good. Change eyes for me. Here we go.
2, 2.
Yeah. One more.
3.
Very good. So a lot of people actually close their own eye when they do that. I do not, but I feel your peripheral vision is intact, and that would include cranial nerve number 2. I also have something. I want you to close your eyes and just smell something for me, and tell me what you smell. Okay.
Alcohol.
Very good. Cranial nerve number 1. Let's see. I'm going to go ahead and look in your mouth, and what I want you to do is stick out your tongue and say ah, and what I'm going to be looking for is just that your soft palate rises, and I want to check your uvula and your, right out, yep, it definitely rose, and your uvula is, does rise and fall, it's midline. Mucosa is all pink, no abnormalities, and I don't see tonsils. Did you have your tonsils taken out? Okay. Very good. And that would be indicative of cranial number 11. And now I'm going to have you do number 12, which is stick your tongue out for me. Up and down and side to side. Very good. Good. And that cranial nerve is intact. 3, 4, and 6 on the ocular motor and the abductions. So we kind of included the eye exam here to start, and now we're going to continue. So the next 3 things I'm going to do is I'm going to look at your ears, your eyes, as well as your nose, okay? And the external part of your mouth, your nose, your eyes, everything looks good. I'm just going to check your, yep, pink. Your sclera is nice and white. And go ahead and look straight at me. And just a little bit of light. Check your pupils and your eye at the same time. I see no defects. And you definitely pearl. And your irises actually look good and intact. The striations are great. So that's wonderful. So I'm going to go ahead and look inside your eye. And some of the things I'm going to be looking at is your optic disc, your fundus, and the vasculature and optic nerves, okay? Here we go. Just look right over my shoulder. All right, definitely red reflex, I see. A little closer. And those vessels are in 4 quadrants. Your optic disc is flat, fundus is intact. And the same here, fundus intact. I see your optic disc, it's flat, shiny, and vessels are in all 4 quadrants. Okay, and your lids look great. Eyebrows are intact, lids, lashes intact. Okay, now I'm going to move on to your ears, okay? Do you have any pain with palpation at all?
Mm-hmm.
Pain with palpation at all?
Nope.
Looks like you have multiple piercings. Ever had an issue with your piercings?
Nope.
Okay, so I'm going to take a quick look. I'm going to pull up and out. And looking for anything abnormal, which would be impactions like from cerumen, any blockages. I see none, no blood, no clear discharge, and your membrane, temporal or tympanic membrane is gray and pearly, and it is intact. And no cerumen. Okay, do you know if I hurt you?
No.
Okay, same thing here. Your membrane, your tympanic membrane is intact. It's grayish pearl, and there's no blockages, and I see no discharge. Very good. Now I'm gonna just take a look at your nose. Okay. Now, do you feel any discomfort with the palpation?
No.
Okay. I'm just gonna take a quick peek. And it looks like your septum is intact. Mucosa is pink, moist. Same on this side, pink and moist. And your septum is intact. Now I'm going to palpate for some lymph nodes. So we're just taking a look at all the lymph nodes in your face and head.
Okay.
Sometimes a swollen lymph node can be indicative of something, okay? So I'm going to start from the back. And I'm going to do your auricular. So your postauricular. Not swollen. Very good. Tonsillar. Preauricular. Not a problem. Occipital. Supracervical. Deep cervical. So I can actually palpate them, but they don't seem very, not necessarily swollen. Posterior clavicular, and then supraclavicular. All right, now we'll do the submandibular. Submandibular, I can palpate them, but they're not swollen. And the submental. And no issues. Very good. Right now, just while we're at your neck, I'm just going to take a look at your carotid arteries and your temporal, and check your temporal pulses. They are present. And then I'm going to check your pulses and then listen to your carotid arteries. Great pulses. Now I'm just listening for what's called thruy or brill noises, which can mean that there's a narrowing. And actually, no, sounds good. Make sure we're still recording. All right, now I'm going to do your chest. So I'm going to start with your lungs, and then we'll move on to your heart. But currently, we're just going to listen. Let's see, for your lungs, we're going to inspect, which I've done, and I don't see any lesions. Palpate, and we're just looking for any deformities, bony or otherwise. And then we'll auscultate, okay? So I would certainly palpate your chest and just look. I'm looking for any indentations or any swelling, any nodes, anything that might be abnormal, and I don't feel anything. Down here's the same, and I'm going to have you just breathe normally. I'm going to count your respirations and the quality as well. Just breathe as normal as you can. And usually we do this for a full minute, but right now looks like you're 14, 16 per minute, and the quality is I would consider normal. And it looks to me like you're 200 or 300 tidal volume per breath, and I think for your size that is absolutely perfect. Now I'm going to listen to your breath sounds. I'm going to start from the front. And when I touch you with this, I just want you to take a nice, even, deep breath, okay? Good. 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 Excellent. Good. One more time. Okay. One more. All right, breath sounds are good from the front. So now I'm going to do the same thing from the back, okay? Good. And so I'm just going to go up and across, or down and across, down and across. Okay, and while I'm here, everything sounds clear. Good air exchange. And while I'm here, I'm just going to have you take a nice deep breath and hold it. And I'm going to mark a point. Okay, now I want you to let it out. Okay. Hold it. Okay. Now I'm going to measure. Looks to be 5 or 6 centimeters. 2.55. 7. So just short of 7. And that's just how much your chest is able to expand and close. And while we're doing this for your nose, I want you to hold one nostril, take a deep breath in and blow out. Next. Very good. Now I'm going to do some percussing, okay? And basically what I'm looking for is, you know, a dullness. Dullness could mean there's a thick fluid collection, hyperresonance, which means there's just a lot more air than should be. It could be indicative of a collapsed lung. Okay? So I'm going to start from the top. Just breathe normal. If this hurts at all, if you feel any pain, you let me know.
Okay.
I would say normal resonance. I'm just going to have you take, I'm going to do 4 more. I just want you to take a deep breath and hold it. And that seems to be normal as well. Okay, you can just relax. Okay, so now your lungs seem to be very good, and have you ever had pneumonia, anything like that? Okay.
Nope.
Smoke?
Nope.
Okay. Awesome. So we're now going to move on to your heart. And the first thing I'm going to do, I've already checked your pulses up here, is I'll go through and I'll check all of your pulses. Start with the radials bilaterally. And they're equal and even. And the brachial. Also equal. And popliteal. Okay, good. And then we'll go to your feet. And then as we say, we just shorten them DP and PT. And yours are extremely strong. Great circulation. And your capillary refill. Very good. Your fingers are all intact. No clubbing. And your nails. No abnormal striations. They seem to be thick, healthy. Everything looks good. Thank you. Now I'm going to listen to your heart. And I'm going to start, so the way we do it is second intercostal space right side, second intercostal space left side, third intercostal space left side, fourth, fifth. And what we're looking for is the valves opening and closing. So aortic valve will be the first, pulmonic valve, Erb's point, tricuspid, and mitral. Okay? And I'll listen really closely because what we're trying to listen for is S2 or S1, S2 sounds, which are normal. That's the love dub. But you can have sounds that could mean something. You could have split sounds. You could have an S3 sound or an S4 sound, and we won't go into what exactly those mean, but that's what we'll be listening to. And then I'll have you lay on your left side, and it just brings your chest wall and your heart closer together and allows me to hear maybe some murmurs that aren't as loud, or maybe even a friction rub, okay? Okay, here we go. So second midclavicular.